So I'm Courtney doing my Pphc Osce for migraines. So we've been called out to Nikita. She's a 21-year-old female who's had a headache since last night. Just getting some history from her. She doesn't have any medical history. She doesn't have any allergies to any medications as far as she knows. The only medication she is on is the oral contraceptive pill, which could always be a factor in here, especially if she's recently changed her type of medication for this. So we'll do a full set of vitals for first assessment, and so the next thing we'll want is just to find out a little bit more about this headache. So whereabouts is the headache?
It's just around here, like
just right in the front bit there? Okay, so it doesn't come radiating round the back or through here,
just
come onto your face at all? Just that front bit there? Okay, how would you describe the pain?
It's just like a normal headache almost, but just a bit more like.
A bit more?
Yeah.
Okay.
Yeah, just.
Yeah, so quite intense.
Yeah, it's just there, you know.
Yeah, a bit of a throbbing one as well.
Yeah.
Yeah. Okay. So how long? So it came on last night.
Yeah.
Yeah. What were you doing when it came on?
I was cooking rice and it got a bit stressful and.
Okay.
Yeah.
Good. So you didn't hit your head at all?
No,
Nothing
just
in the
got
past
annoyed
week
at
where
rice.
you've hit your head either?
Yeah, no.
Okay.
It's just
Cool.
cooking.
Yeah. And so with it coming on, have you experienced any sort of visual disturbances or any pins and needles anywhere?
No.
No. So you got no aura related with it?
No.
Okay. Have you ever had these headaches before?
No, I don't think so.
You haven't?
No.
Okay.
Not well, maybe in the past a little bit, but
Yeah.
this has been worse. Yeah.
Okay. Cool. So we've got a little bit of history there. Sounds like it might be a migraine, but I'm going to go through the headache red flags, so we can just because there's a lot of different types of headaches as well. We want to make sure that we're not missing anything important. So the first one, headache or neck pain following neck manipulation. So if you just move your head from sort of side to side and twist it round, is that changing anything? You got no pain throughout your neck at all? Cool. Just in general, you don't have any pain or stiffness throughout your neck?
No.
Great. So sudden onset of severe headache. So the onset, was that gradual or was it very sudden?
It was just gradual and then
And then quite intense.
yeah,
Okay.
when I was cooking.
So that's good. And we've already got a temperature, so we know that she's below 37.5 degrees. You don't have any influenza symptoms, no coughs or colds or anything like that?
No,
Perfect. Have you been vomiting at all with it? Cool. Have you felt nauseous at all either?
No.
Cool. So the next one is the focal neurological signs. So with them I'll just do the cranial nerve checks for that. So just come around closer to it. So just get you to do some different things. The first one is the olfactory.
Yeah.
So if you just block one of your nostrils and then I'll get you to smell something and then we'll do it with the other nostril as well. Okay, was that any different?
No.
The smell there, you can smell both them. Perfect. Next one is the oculomotor, trochlea and absence. So with that we can do pupil torch, check the reaction of her pupils and make sure that they're equal. And then we'll also just get you to follow my finger across here. Cool. So you can see that that's working well. The trigeminal nerve, so face sensation. So I'll get you to close your eyes and then just say yes when you feel me touch your face, okay?
Yes.
Cool.
Yes.
Yes. Awesome. So that one's good. Do the facial nerve, so I'll get you to scrunch up your face. Awesome, and then sort of open it really wide. Yeah, perfect. Then it is the vestibular cochlear nerve, so close your eyes and I'm gonna snap in your ears and I just want you to tell me when you can hear that, okay?
Left.
Yeah, and
Right.
perfect. So that's great, and the next one is the vagus, so just open your mouth wide and say ah.
Oh.
And then E.
E.
Cool. And the accessory nerve, so shrug your shoulders up. Cool. And then the hypoglossal nerve, so put your tongue out. Just sort of move it from side to side of your mouth. Yep, and that feels all normal. Awesome. So those are all good. So now we can go back to the rest of our red flags. So throughout when you've had this headache, you haven't had any change in your level of consciousness?
Mm-mm.
You haven't felt real
No.
dizzy or super sleepy or anything like that?
No.
Perfect. And we know that you're not taking any anticoagulants,
No.
and you don't have any sort of bleeding disorder?
Mm-mm.
Perfect. So next one is the signs of temporal arteritis. So if I just press on there, does that hurt at all? Just on your
No.
no, that's fine. And check the other one as well. So that's all good there?
Yeah.
Cool. And I can feel that they're pulsating well, so there's no decreased pulsation there. So yeah, you've also confirmed you haven't had any trauma to your head recently. You're not pregnant at the moment?
No.
Great. You don't have any history of any sort of bleed throughout your brain?
No.
Cool. Do you have any family history of anything?
No. Or
Any of that? No
healthy?
cerebral
No.
vascular abnormalities? Great. And so the onset we already know wasn't during sexual activity?
No.
Just cooking rice?
Yeah.
Okay, cool. So all those red flags check out, but we do know that we have one orange flag, which is the migraine with symptoms different to usual. So she said that she has had these before, but these are a little bit different and more intense to usual. So we'll keep that one in mind. So I just want to get another check with your pain. What would you give it out of 10?
Like a 4, 4.5.
Okay.
Yeah.
Have you taken any pain medications for that?
No, I haven't.
No. Would you like some? We can give you some paracetamol and
Oh, yeah.
ibuprofen.
Yeah, that'd be good.
Yeah. Okay. So we'll just give you those two. We're not going to give you tramadol or any sort
Okay.
of opiate,
That's
just
fine.
because they can cause worsening of migraines. So we have our medications here. So we've got paracetamol and ibuprofen, and I'll check them with my offsider to make sure that those dates are fine. Do you want to do that? Thanks.
200 megs ibuprofen and day. 200 megs. Oh, sorry. Yeah,
500
One, yeah.
paracetamol. Perfect.
and day.
Awesome. So we'll be able to give you, we'll give you 1 gram of paracetamol and 400 milligrams of ibuprofen. So pop them into your hands and give you some water, and you can take them. Cool. So at the moment, what's your main concern? So these medications should help you, and I don't think we do need to transport you through to hospital.
Okay.
Are you happy with that? And that just if anything does get worse, we can always like go see your GP and maybe see if you do need to change
Yeah, that's
your old contraceptive maybe, or just do a bit more examination into it. Cool. So the next thing we can do is the non-transport pause and checklist. So the first one, so we've fully assessed her. We've got all the vital signs which are normal, which is great. There's no serious injury or anything like that, no red flags, and we'll just make sure that we've seen you mobilised before we leave. And you're happy to look after yourself from here, aren't you? You've got all of that. You've got no questions or anything?
Do you have an information sheet or?
Yes, you do.
That'll be interesting. Yeah.
Yep, let me give you this information sheet here, which has
Thank you.
more information on it for you around migraines. And
Okay.
yeah, if you do have any worries, you can always also call Healthline or go see your GP.
Okay.
If it gets really bad and you have any sort of visual disturbances or sort of any sensations, sort of pins and needles, or struggle walking or anything like that, you're always welcome to call us back as well, and we can check you out a bit further.
Thank you.
Alright, so this is my paramedic primary healthcare epistaxis, Osce. I've been called to Bethany here, a 23-year-old female whose chief complaint is a bleeding nose, also known as an epistaxis. So Bethany, the bleeding has been consistent for 25 minutes or so now.
About, yeah.
Yeah, and you've been applying direct pressure for roughly the same time.
Yeah.
Alright, so walking in, I want to gather a history. I want to see what I want to take, I want to observe what's going on, see if there's any signs of hypovolemic shock, I want to look for how much blood she's potentially lost. We may have to act quickly. I want to know if Bethany's on any anticoagulants. I want to get my offsiders to take some vitals to see if she's hypertensive or not, see if she does live with hypertension. Bethany, have you recently had any trauma to your face? No trauma to your face.
Oh, well, it's embarrassing to say, but I was picking my nose.
Okay,
That's
so
when
that
it
could
started.
be considered as digital trauma. Have you had any recent surgery?
No.
No, so that's something also to consider. Humidity in the room, is it warm? If it is, we want to preferably remove Bethany from the warm room to promote vasoconstriction. So what I want to do is I want to know if the bleeding is still going or not. To do that, I can simply just have a look. If you could just release it for a minute, Bethany, so the bleeding will continue. So if it had stopped after the 15 to 25 minutes of compression, unless she's on anticoagulants, what we can do is there's no further checkups required. But I would advise Bethany to see a GP within the next 24 hours if she were on anticoagulants. With mild epistaxis, I also want to make sure there's no kind of airway compromise, so I want Bethany to spit out while leaning forward. Any kind of blood she has in the back of her throat, because if she does swallow that, it can make her vomit and make the bleeding worse. I could also consider things like an ice pack at the back of their neck, at the back of Bethany's neck, to see if that works. If it doesn't work, compression's not working, what I want to do is, it's severe, I want to think about adrenaline administration, possibly backup as well, if I'm an EMT. So Bethany, that's my plan. It's still bleeding.
Yep.
You're losing quite a lot of blood. I want to draw up 1 in 10,000 adrenaline, administer that intranasally. Is that okay with you? Alright, so what I'm going to do is take my 10ml syringe, drying up the saline first. I'm going to drug check with my offsider the saline. First, Nikita, if you could do that for me.
Saline 10 mils, expiring 2020.
Thank you very much. Saline, 10 mils. It is in date. Do you have any allergies, Bethany?
No, not that I know.
So I'll draw up 9 mils of the saline. Draw up that first so I don't have to expel any of the drug that I'm going to put in. So I'm just going to attach a drawing up needle now. Right. Got wet gloves at the moment. I'm just going to pop that down. Oh, okay. I'm going to drug check my adrenaline. Nikita?
Adrenaline 1 milligrams, expiring 2020.
Thank you very much. Adrenaline, 1 mix, 1 mil. It is in date. Okay. Oh. How you going, Bethany?
Not too bad.
Not too bad.
Yeah.
So what I'll do is I'll draw all of that up. Putting that straight into there. Okay. So now I've got the dose I want. Popping that back on there. So what I want to do is just attach my MAD, my mucosal atomizing device. Oh, add my, make sure it's adrenaline here. And I want to add administered 2 mils into each bleeding nostril. So to make life a little bit easier, administer that 2 mils in. Put this in a 3 mil syringe. All right.
Mm-hmm.
Okay. Place that down, try to keep it as clean as possible. Okay. Before I do this, I do want to prime my mat. What I'll do is, because I've got some of it spare. Alright. So now that that's primed, oh, wait, again. So what I'll get Bethany to do before I administer the 2 mils into the bleeding nostril is below her nose as hard as she can to get any clots out, so we can administer the drug to the site of the bleeding to get that vasoconstriction and the and then I'll reassess. Okay, so I want to get I won't put it to your nose, definitely, but I'll get her to lean back a little bit. I'll insert it into the bleeding nostril, get a bit of an angle on it, so I want to hit the site of the bleeding, and I want to put quite a bit of pressure to atomize the drug. So I'll just do that over here. So you've blown your nose,
Yep.
get rid of all the clots.
Mm-hmm.
Okay, so I'll do that in both bleeding nostrils, get you to compress that again for another 15 to 20 minutes. Pop that straight in there. So after the 15-20 minutes, we'll reassess. If it has stopped, depending on how much blood she's lost, if she's on anticoagulants, I want to transport, if that's okay with you. If it has not stopped, definitely getting back up on the way, we can consider an ETT tube or nasal packing. And if I see signs of shock, I want to consider also administering some fluid. Okay?
Yep, sounds good.
Cool.